Next thing we're going to do now is we're going to learn how to draw blood from a central line. It's a fairly easy process. First, let's gather our supplies. The supplies that we need to get are, I like to get 3 normal saline syringes, and I always will take them out of their package and get them ready to go, all right? So 3 normal saline syringes, and you will need the specimens or the vials that you need in order to get your blood draws that are ordered. And then you will need what's called a vacutainer. And the vacutainers will look like this. They'll come like this, but we will take this part off of it and just use it as just a vacutainer straight from the actual central line itself. And then lastly, what you'll need is a valve. And these valves go on the end of your catheter, all right? Now I get everything ready. I'll get my normal saline syringes ready. I'll go ahead and get the release of pressure on the normal saline syringe and get the air out, so I don't have to worry about that. And then I usually will, when I'm getting my air out of my syringe, when I'm putting my top back on, I put it on loosely so I don't have to mess with it at all. And then the last one I will replace the top with the actual new valve so that I can put a new valve on at the very end of my blood draw. And I just kind of do it all in this kind of same order. All right, then the next step is I put everything out in the order of the operation that I'm going to use them. So the first thing that I would do is I'm going to flush my catheter, and then I'm going to need to start to use my vacutainer, and then I'm going to need to use the blood vial to draw up, and then lastly I'm going to flush my catheter at the very, very end. Always wear gloves because you're coming in contact with blood and body fluids. And then you're going to select the lumen. The lumen I'm selecting today is the distal lumen. It's okay to choose any lumen, but the distal lumen is the largest of all 3, and it's a 16 gauge lumen, and you reduce the risk of lysing your cells, and it usually is a better blood draw experience, you could say. All right, next thing is you're going to take off your Kuros cap. The Kuros cap is the cap that keeps it clean. If this cap is intact and on your actual valve itself, you do not have to clean with alcohol. This cap has to be present for at least 3 minutes in order for you to be able to just take it off and use it regularly. If that is there, then I do not have to get any type of alcohol prep. I'll take off my syringe and then I'll flush. And usually you have to flush at a quicker pace, and then I use a pulsing technique. And then after that, as soon as it's there, you're going to pull back and obtain blood return. And usually you want to pull back and waste about anywhere from 6 to 8 mLs of blood. And the reason for that is this is not our specimen. We waste this product because it's diluted. The specimen would be diluted if we were to use this one. So we're going to go ahead and just discard of that one. We're going to put our vacutainer on. Put our vacutainer on. And then you're going to put your actual specimen in there. With a vacutainer, it automatically fills up. Of course, in this situation, it doesn't, but it will automatically fill up with blood. And once it stops getting the correct amount, it will stop on its own. So once it stops on its own, then it will look like this. All right? That's what your specimen will look like. I usually will manipulate it a couple times just so it doesn't clot up on me. And then the next step I will use is to go ahead and flush it afterwards. I'm going to undo that. And then I'm going to flush. Same type of technique, that pulsing technique. Doesn't have to be too slow. And then I will normally flush with 2 syringes, 20 mLs of fluid, because I want to get the whole line clean. It reduces the risk of those little clots forming on the end, and you don't have that catheter malfunction. So before I change this one, I'm going to be changing the valve, and I don't want to cause any complications or an air emboli. So please, please make sure you clamp this tube before you do that. Clamp that tubing. You're going to clamp the tubing, and then you're going to take this one off. I'm having difficulty with getting it off, so I'm going to put down my syringe. And sometimes your gloves will get wet. So I'll get another glove and put that on the inside and then twist. And then that gives me that traction that I need to kind of take that off. All right. I'm going to put the new one on. Unclamp. I'm going to unclamp. All you do is just slide it over, guys, to unclamp. And then now I'm going to push it with a second syringe of normal saline just to clear my line out so I'm ready to go and be able to use it the next time. Lastly, what you'll need to do is you'll need to put a brand new Kuros cap on your catheter. These are only a one-time use, so make sure you get a brand new one. They're typically located on your IV poles when you have your in your patient's room. So you'll take one of those and put a brand new one on the end of your cap, and then you're ready to go for the use next time.